Thank you so much. Thank you for coming to this presentation. I found this article titled "Severe Pneumonia in Neonates Associated with Legionella Pneumophilia: A Case Report and Review of the Literature." And the reason why I chose to present this article was because I actually came across a patient, a 3-month-old in the PICU in one of my away rotations not too long ago. And it was just a very interesting case, and I wanted to talk more about this really rare form of pneumonia in neonates. And then I'll talk more about the case report that I'm going to do about this patient a little bit later at the end. So introduction, respiratory tract infections in neonates have a significant impact on morbidity and mortality. And a lot of common sources are other bacteria, viruses, or even protozoa, but Legionella is actually pretty rare cause of pneumonia in neonates. And a lot of the sources come from water. So like hospital, birthing pool, home water births, humidifiers, or even incubators in the NICU have found to be sources of Legionella. And the key to treating this type of pneumonia is with early diagnosis and adequate treatment. So a little bit about the actual case report that they presented. This was a full-term neonate, and she was born in a hospital birthing pool. This was mom's second pregnancy, and of note, her parents are related. She was discharged in a healthy condition, and then on day 10 of life, she actually presented with a fever of 38.1 degrees Celsius, and she was admitted for respiratory distress. So at this point, they were thinking like some type of neonatal late onset sepsis. So she was started on ampicillin and gentamicin. But so they did the initial x-ray, which is what this image is showing, and it did show right-sided pneumonia, and her hypoxemia continued to worsen, so she was eventually intubated and placed on a vent. Her antibiotics were increased to meropenem and vancomycin. They also added some antivirals, and then on day 4, while she was admitted, she was actually placed on ECMO, and I'll talk a little bit about what ECMO is a little bit later. They did some more imaging, like with CT and X-ray, and that showed bilateral pneumonia with effusions and ground glass opacities. I have that on the next slide. And then she actually had to get a bronchoscopy done where they did a bronchoalveolar lavage. And with that testing and those samples taken, that's when they found that she was actually positive for Legionella. And then another thing that they were also working up at the time was that due to the fact that her parents were related, they did an immunodeficiency workup, which was unremarkable. So once they found that she was actually positive for Legionella, they switched her antibiotics to levofloxacin and azithromycin. On day 10 of her being admitted, she got this generalized erythematous macular rash, which you can see on that picture, which is pretty common to see with the Legionella infection. She was stable for a few days after that, but then unfortunately on day 22, ECMO was discontinued due to thrombotic complications in the circuit, and there was truly no improvement in her respiratory status, and then she did die on day 30 of cardiopulmonary arrest. So for this article that I read, these are the main items they were searching for in terms of trying to find papers related to this. They found a total of 191 and only 45 cases were analyzed. So results, epidemiology, from their literature review, 71% were non-sequomial, so mostly from water samples from the hospital. 24% were community acquired from like home water births, and then 29% had an underlying disease such as immunodeficiency, congenital heart disease, or like a fistula. Clinical findings. All of these reports did describe some form of ARDS, signs of pneumonia, severe respiratory insufficiency, and use of mechanical ventilation. Only 15 patients had a fever, and 3 actually had sepsis. So some diagnostic studies. Diagnosis about Legionella was in 27 case reports. Only 10 did a tracheal aspirate, 24 did a culture, 3 actually did a PCR. And of the 15 cases that did the urinary antigen confirmatory test, only 12 of those are positive. Treatments and outcome. So antibiotics were used in 27 cases, macrolides in 21. And of note, those who did not receive a macrolide died. 5 patients received ECMO. Of those that were decannulated, 3 survived and 1 died. And in 30 reports, 17 patients actually recovered. So a little bit about discussion. So like I said earlier, this is an extremely rare case of pneumonia in neonates. It has been shown in some of the literature that any type of immunosuppression or pre-existing lung disease is a risk factor. And when I was reading this article, previous studies had shown that underlying disease in patients had a much higher numerical value, but when they were doing this literature review, it was only found to be in 29% of patients. And clinical features are truly non-specific, so physicians need to have a high index of suspicion to make sure that they're testing for Legionella if they have a patient that's a neonate and presenting in a pretty severely sick. Another thing, this patient that they did the study on, her urine antigen test wasn't positive for Legionella. So they did the PCR test, which did show Legionella, and then they did cultures like tracheal aspirate cultures, and those were positive. So kind of the standard right now is to do the urine antigen test and cultures, like do a combined effort for diagnosis, but PCR is extremely advantageous because it can give you much better results, and it can screen for a whole bunch of things, and it leads to being able to treat these patients more effectively. And the first line therapy is macrolides and quinolones. So even though, they were able to do this workup, in neonates, there is still a pretty high mortality rate of 50% if they're under a year old. And extracorporeal life support in early course can really improve outcomes. I have listed here some criteria that patients need to meet in order for ECLS support to be used. So this patient, she was placed on VA ECMO, which offers cardiac and respiratory support. So you're able to help pump the blood, as you can see in this image, and there's an oxygenator to do oxygen carbon dioxide exchange, and the sweep gas is also removing excess carbon dioxide. And like I said earlier, water is a natural reservoir for Legionella, and a lot of hospital systems are already testing their water supply quite frequently. And routine culturing and birthing pools can protect future neonates, especially if they're doing like a home water birth or birthing a pool at a hospital. Sometimes when they're using that, the water is not really tested effectively, is what I read from this article. So I think if hospitals were to implement more structured testing, we could really prevent this from happening in neonates. So in conclusion, Legionella pneumonia is a life-threatening disease. You want to suspect this in cases of pneumonia and sepsis that are not responsive to beta-lactam therapy. Gold standard, like I talked about, is urinary antigen testing, culture, and probably adding PCR is going to be more effective too, and considering ECMO. So yeah, that's kind of what this case report was talking about. But I really want to highlight, because when I did my away rotation and I encountered a 3-month-old with this severe type of pneumonia, I mean, it was truly shocking to see her clinical state. And even the attendings that I was with said that they had never seen a neonate have Legionella pneumonia, that was not at all what they were suspecting. We were going the whole immunodeficiency route, but then we were able to find this because the ID doctors sent out a special type of test, like a Carius test that was sent out to California. And that's when they figured out that she had Legionella. So all of her care changed. But so from a medical standpoint, it was super insightful to see that level of care and see how we can offer support to neonates in this example. But the other side that I did want to highlight from the case that I saw, that I will be doing a report later on, is more of the human side of medicine. Like, there was so much going on with her medically, and so many people were involved in her care. But then the other side of it was that her parents were really involved. They're extremely worried. They're trying to figure out, you know, it's a day-to-day thing for her. It's hard to predict her outcome because she's requiring so much support and she's so delicate. So it was just a good reminder that even though we're soon to be physicians and we work in healthcare, and sometimes it's really easy to get swamped by all of the uh, medical things we're doing, it's also a good chance to reflect on the more ethical side, the more empathetic side of medicine. Remember that this is a family, this is their newborn baby, that they did not expect to have this, severe illness. And we have to remember that we're really there for the patient and for their family to offer emotional support too, and that this is a tough case. It's not something that it's not easy to go through. So I really appreciated getting to see that aspect of medicine. Any questions? That's all I had.